feel like they're being pulled away, what can the state do to ensure everyone in need? Let's move to a second topic we've already touched on with incumbent Joe Knilans and challenger Deb Kolste. Healthcare obviously concerns both at the federal level but also in the state, how to make sure people are covered. We've had some opportunities. Some people feel like they're being pulled away. What can the state do to ensure everyone in need has at least an opportunity for health care?
Well, we can look at Badger Care for one example. Governor Doyle expanded Badger Care, and it went from 99,000 up to several hundred thousand within 1 month, which put a huge tax on the state for filling in and paying for those people. Now, what we need to do is use Badger Care as a secondary for a lot of people. There are a lot of people who are working and they are using Badger Care because it's a little cheaper, but it's also better benefits, but it's also subsidized by the taxpayers. Have the people who have full-time jobs that can get employer-based insurance to take the employer-based insurance. Badger Care could fall in as a secondary to help take care of those people who might need that if their own insurance doesn't cover everything. That way it takes the burden off of Badger Care, and Badger Care may be able to expand. I talked to many people who are laid off right now. They've been laid off for 2-3 months, and the problem is they apply for Badger Care is full, and they can't get that temporary service while they're looking for a job. And that's what Badger Care is for also, is for those temporary people that fall out of employment and they need some coverage to help them until they find another job. Well, we can't even take care of those people because the system is so overwhelmed with people
so
that...
Basically, you feel like the state's Badger Care could do the job if people who had other opportunities for health care were to take that?
Yes.
Okay.
Yes.
How do you feel the state's doing on health care, Deb?
I think we failed miserably. We have the opportunity to start investing in the Affordable Care Act, putting in health insurance exchanges, and we have an implementation grant that's not being used. We also have the ability to take federal dollars and help put more people on Badger Care. You know, I have the opportunity, pardon me, I have the opportunity to work with people every day that are working full-time. You know, when I work at HealthNet on Wednesday afternoons doing intakes, almost everybody we see that comes in has full-time jobs. They just don't have any health care benefits. We need to get that exchange set up so that people can compare apple to apples. They can, you know, it's kind of a perfect marriage of consumerism and the private, you know, the private markets being able to work together. We need to get that implemented so that people have the ability to get an insurance product, and we also need to open up so that people have the opportunity to get in Badger Care. We now have a waiting list of, I don't know, 200, 300,000 people that are, and it's time that we quit selling health care to the highest price bidder.
Affordability, big gaps. What do you feel about the exchange, the Affordable Care Act?
Well, Governor Walker has the opportunity to look at that, and we'll find out after the election. I am not a supporter of the Affordable Care Act because I think that it should be left to the state, the federal government. To give you an example, I talked to a lady, I was knocking on doors, she was from the Czech. And we were kind of discussing, and she was concerned about different things. And her daughter was laid off, and she was concerned because her daughter couldn't get Badger Care. So I was asking her about different things, and she said when she came from the Czech, she left that country because it was socialist. And she moved to the United States because of the opportunity that she saw here. And she said to me, she further said, she goes, the United States is moving towards socialism with this health care law. She goes, the federal government has no business controlling health care because it's way too big and too much corruption will happen. It should be put down on the state levels and let each state come up with their own plan to take care of the people in their state. That would be better off because you could find the fraud and you can find the abuse that's happening within the health care, which there is. And that's why we've got people going to HealthNet that have full employment, because the Badger Care is so full of people who could do something else to open it up for those people who can't. And that's how you can open up Badger Care even more. But one more thing, Badger Care, we have to sit back and look at who pays for Badger Care? The taxpayers. So the taxpayers are subsidizing for people who are abusing the system. So not everybody. There are a number of people out there abusing the system. I hear it from people knocking on doors when they tell me, well, the person down the street has been laid off and he doesn't want to find a job and he's just sitting back collecting his food share and his Badger care. And I'm struggling to work every day for what I have, and I'm tired of seeing that. And people are tired of seeing the abuse of Badger care and health care.
Deb, is correcting any abuse or changes in Badger care the answer? And
Wait.
why do you like the Affordable Care Act, since obviously Joe is against it?
Well, you know, it's always amazing when we talk about abuse and people being dependent or feeling like they're victims because they don't have the same abilities of all of us. There are abuses in every system. There are abuses on the financial side with financial institutions, on people that cheat on taxes, but all of a sudden the thought that somebody might actually get health care to take care of themselves and their family creates this instantaneous outcry of abuse. The people that I see are not dependent on the government, and they are not victimized. They have been laid off from work opportunities, or they have some pre-existing condition that has made it physically impossible for them to hold down a job. So I think the affordable, to me, it is time to quit selling health care in people's lives to the highest bidder. I think that people should be taken care of. I think the Affordable Care Act, although in my estimation, I agree, it's not the perfect thing, but it is a start. It gives people an opportunity to assess health plans and see if there's some plan they could fit in that doesn't involve public monies. We're missing that opportunity also. There are opportunities within the private healthcare industry to get insurance without going on public registers. And can I just say one other thing?
Go
When he
right
talks
ahead.
about, Joe, when you talk about the government shouldn't be directing it, right? Because it's scary that the government should be directing our health care. I find it even scarier that a private, for-profit corporation in the form of an insurance company will absolutely be directing my health care.
All right, Joe, yeah, you better go ahead.
Okay. The reason that I fear the government controlling everything is that the government will be able to say, when you're 65 and you have a hip needs to be replaced, through their productivity, and this is what other nations use too, you're not as productive for society, so we will not give you a hip replacement. We'll give you something to comfort you. That is what's happened in other countries, and that's what I foresee in the United States. But also, when we look at insurance companies and we talk about the healthcare exchanges, what's going to happen is that these small, medium insurance companies are going to be gone because they're not going to be able to live up to the government regulations and the government expenses and costs that are going to be put on the insurance companies, which is going to we're going to lose a bigger variety of what we want, and we're going to be looking at 3 or 4 or maybe 5 humongous insurance companies are going to cover everybody in the United States. And that is not giving us the ability to look and pick what we want. We're going to be mandated to take what is given us, and that is not free market, and that is not United States.
All right, wait a second.
One last thing, but especially in healthcare, the United States is not even in the top 25 in any outcomes.
That's why leaders and people from other countries, including Canada, come to the United States for their better health care, because we provide the best health care. We pay the doctors the most, and they research the most, and the education is the best here. I think that's.
But Joe, but you can't say that anecdotally, because somebody comes to a specialized clinic in the United States where they know that we have the most expensive health care, so we do have some things, it's some exclusive things. But we are not in the top 25 in longevity, morbidity, mortality, infant mortality, disease rates. That we are not in the top 25 in any of those.
Well,
the only top one we are is that we spend the most money.
Let me say something. We are in the top 25 for obesity.
And there are
lack of physical fitness, but that's all right.
Well, cost effective because